what are the dry eye treatment risks? Well, the risks of dry eye treatment are very low. Most patients respond well to treatment with drops, artificial tear drops for treatment of their dry eye. And we tend increasingly to use preservative-free eye drops. Traditionally, artificial tear drops had a preservative in them. They came in a little bottle and the preservatives stopped the drops going off. But what we learned was the preservative themselves can react with the surface of the eye. So the reaction may be that they're slightly acidic, and so they cause an acidic effect on the surface of the eye, which of course can make the symptoms of dry eye worse. Also, some people are frankly allergic to the preservatives in dry eye drops. So they would get itchy, puffy, sore eyes as if they had hay fever. So we've learnt that using artificial tear drops without preservatives has been a huge step forward in the treatment of dry eye. Because essentially the drops have no drug in them, they're simply wetting solutions. They don't cause any toxic effects in the sense of a drug. There are more advanced dry eye drops which we use. There's one called cyclosporin, which is an anti-inflammatory drop, and that is a drug, but it's used once a day in very small doses, so it doesn't have a systemic toxic effect. So in terms of dry eye treatment from drops, there really are very few risks. With dry eye, it may be because not enough tears are being produced, or the plug hole, the little drainage canal on the inside of the eyes, is draining tears too quickly. So one may want to treat that drainage canal. One can put a little plug in it, a little silicone plug to occlude it, or one can permanently occlude that tear duct. But we always start off with the silicone plugs. Occasionally you can put a plug in the eye and it can slightly rub on the surface of the eye and cause irritation, so one has to remove it. But that's a temporary effect, so it's not really a risk. I mean, there's a risk that it could rub the eye, but it's easily addressed. If artificial tear drops work well, then one can permanently occlude the tear duct opening by heating it with some cautery done under local anaesthetic, so one may get a bit of bruising with that treatment. So fortunately for us, dry eye, which is common, has lots of treatment options, and the risks of them are already very low, and I don't think any of them cause a permanent issue.